Understanding your body is the first step toward health and empowerment. Today, we're going to talk about the female reproductive system in a clear and simple way. This system is incredible, designed for pleasure, reproduction, and so much more. Our journey begins on the outside, with the parts you can see and touch. It's important to remember that every single body is unique and beautiful. There is no one normal way for these structures to look. Learning the correct names for your body parts helps you communicate effectively with doctors and feel more confident in your own skin. This knowledge is a powerful tool for your well-being. The term for the external female genitals is the vulva. This is not the same as the vagina, which is an internal canal. The vulva includes several important parts, starting with the mons pubis. This is the soft, fatty mound of tissue located just above the pubic bone, which is typically covered with pubic hair after puberty. The vulva also includes the labia, which means lips in Latin. These are folds of skin that protect the more sensitive areas within. Think of them as the gatekeepers to the reproductive system, providing a natural barrier against friction and infection, while playing a role in sexual arousal. The labia are divided into two sets, the labia majora and the labia minora. The labia majora are the larger outer folds of skin. They are often fleshier and contain sweat and oil-producing glands. After puberty, hair usually grows on their outer surface. Nestled inside are the labia minora, the smaller inner folds. These are more delicate and do not have hair. They vary greatly in size, shape, and color from person to person. Sometimes they are hidden by the labia majora, and sometimes they extend beyond them. Both variations are completely normal and healthy, reflecting the beautiful diversity of human bodies. At the top of the vulva, where the inner labia meet, is the clitoris. The visible part is called the glans, which is a small, highly sensitive nub of tissue. It is protected by a fold of skin called the clitoral hood, similar to the foreskin on a penis. The clitoris is an amazing organ dedicated solely to pleasure. It contains thousands of nerve endings, making it the most sensitive erogenous zone. What you see on the outside is just the tip. The clitoris has an extensive internal structure that extends back into the body, like the roots of a tree, contributing significantly to sexual response and orgasm. As we move inward from the vulva, we find the entrance to the vagina. This area is called the vestibule. It's the smooth space located within the labia minora. The vestibule houses two important openings. The first is the urethral opening, a small hole from which urine leaves the body. It is located just below the clitoris. It's important to know that the urinary and reproductive tracts are separate in females. The second, larger opening is the vaginal opening. This is the entrance to the vagina itself, a muscular tube that connects the vulva to the cervix and uterus. Both of these openings are vital for the body's functions. Surrounding the vaginal opening in some individuals is the hymen. The hymen is a thin piece of mucous membrane. For a long time, it was incorrectly associated with virginity, but this is a myth. The hymen can have many different shapes and is often naturally open to allow menstrual fluid to pass through. It can stretch or tear for many reasons completely unrelated to sexual activity, such as through sports, using a tampon, or even just through normal growth. The presence, absence, or state of the hymen does not indicate anything about a person's sexual history. It's simply a piece of tissue. The vagina itself is a remarkable organ. It's a muscular and elastic tube, typically about 3 to 4 inches long, that can stretch significantly. Its walls are made of soft, flexible tissue that is folded into ridges called rugae. These folds allow the vagina to expand during sexual intercourse, and, most dramatically, during childbirth to allow a baby to pass through. When not aroused or in use, the walls of the vagina gently touch each other. It is a self-cleaning organ, maintaining a healthy, acidic environment to protect against harmful bacteria and infections, which is why douching is generally not recommended. For comfort and function, the vagina needs lubrication. This natural moisture is produced by glands located near the vaginal opening. The most well-known are the Bartholin's glands, two small glands situated on either side of the entrance to the vagina. During sexual arousal, these glands secrete a fluid that helps to reduce friction and make intercourse more comfortable and pleasurable. Other glands within the cervix and vaginal walls also contribute to the overall moisture, which can change in consistency and amount throughout the menstrual cycle. This lubrication is a normal and healthy part of how the body works. Deep inside the body, beyond the vagina, lie the internal reproductive organs. At the very top of the vaginal canal is the cervix. The cervix is a narrow cylinder-shaped neck of tissue that connects the vagina to the uterus. You can think of it as a gatekeeper. It has a tiny opening called the os, which allows menstrual blood to flow out and sperm to travel in. During pregnancy, the cervix remains firmly closed to protect the developing fetus. Then, during labor, it undergoes a remarkable transformation, thinning out and opening wide to allow the baby to be born. The cervix leads directly into the uterus, also known as the womb. The uterus is a hollow, pear-shaped organ with strong, muscular walls. This is where a fertilized egg implants and a baby grows during pregnancy. The inner lining of the uterus, called the endometrium, is rich in blood vessels and nutrients. It thickens each month to prepare for a potential pregnancy. If pregnancy does not occur, this lining is shed, resulting in a menstrual period. The uterus's ability to expand from the size of a small pear to accommodate a full-term baby is one of the most incredible feats of the human body. Flanking the uterus on either side are the two ovaries. Each ovary is about the size and shape of a large almond. These small glands have two massive jobs. First, they produce and store a woman's eggs, or ova. A person is born with all the eggs they will ever have. Second, the ovaries are the primary producers of the main female sex hormones, estrogen and progesterone. These hormones are crucial for regulating the menstrual cycle, supporting pregnancy, and influencing many other aspects of health, from bone density to mood. They are the chemical messengers that orchestrate the body's reproductive functions. Connecting the ovaries to the uterus are the fallopian tubes. There are two of these thin, delicate tubes, one on each side. The end of each tube near the ovary has finger-like projections called fimbriae that help sweep an egg into the tube after it is released from the ovary. This journey down the fallopian tube is where fertilization, the meeting of the egg and sperm, typically happens. The fertilized egg then continues its travel to the uterus for implantation. The fallopian tubes are the essential pathway that makes the connection between egg release and pregnancy possible, serving as the bridge between the ovaries and the womb. The menstrual cycle is the monthly hormonal rhythm that prepares the body for a possible pregnancy. It's much more than just your period. An average cycle lasts about 28 days, but it can range from 21 to 35 days. And this is perfectly normal. The cycle is driven by the rise and fall of hormones, primarily estrogen and progesterone, which are produced by the ovaries. It begins on the first day of your period, which marks the start of the follicular phase. During this time, estrogen levels rise, causing the uterine lining, the endometrium, to thicken and develop in preparation for a potential fertilized egg. Around the middle of the cycle, usually about day 14, ovulation occurs. This is a key event where a surge in hormones causes one of the ovaries to release a mature egg. The egg then travels into the fallopian tube, where it can be fertilized by sperm for about 12 to 24 hours. This is the most fertile time in the menstrual cycle. Some people can feel a slight twinge of pain during ovulation, but many feel nothing at all. Understanding when you ovulate is important for anyone trying to conceive or, conversely, trying to avoid pregnancy. It is the central event that the entire cycle revolves around. After ovulation, the luteal phase begins. The ovarian follicle that released the egg transforms into a structure called the corpus luteum. This structure starts producing progesterone as well as some estrogen. Progesterone's main job is to keep the uterine lining thick and ready to nourish a fertilized egg. If the egg is fertilized and implants in the uterine wall, the body will continue to produce progesterone to support the early pregnancy. This phase lasts about 14 days. and the hormonal changes can sometimes lead to premenstrual symptoms like bloating, mood swings, or breast tenderness. If pregnancy does not occur, the corpus luteum breaks down. This causes a sharp drop in both progesterone and estrogen levels. This hormonal drop signals the uterus that it's time to shed its lining, which is no longer needed. This shedding of blood and tissue from the uterus through the vagina is the menstrual period or menstruation, which marks the end of one cycle and the beginning of the next. While not part of the internal reproductive system, breasts are also connected. Hormones from the cycle cause them to develop, and after childbirth they are able to produce milk to feed a newborn, completing their role in the reproductive journey. Knowing your body is a lifelong journey, and if you ever have questions or concerns, please speak with a trusted healthcare provider.